can I ask you about regulations and what your thoughts are on how we get regulated on social media and on information about aesthetics? Because traditionally, the regulations that surround aesthetics and aesthetic products is similar to other areas of medicine, and for good measure.
Yeah.
You know, I think, for instance, we don't want people advertising that they preferentially use one type of hypercholesterol medication over another. I think that's a little bit inappropriate. But in aesthetics, it's different because these products, they are different, and people do have preferences, legitimate preferences, and there are reasons why somebody prefers to use one product over another. And in some ways, it's not clear to me whether it's appropriate to say that and be open about that. So, do you think that we should regulate how we educate the public about our aesthetic use of products differently?
Um, what I will say, that's a tough one. I mean, I got to be careful about what I say on that one. There's opinion versus reality too, right? And
We
you
just want
know,
opinion. We're separated from reality here.
yeah. Well, let's lay the foundation because I do think that, well, I know we are regulated, as a company, as an industry company, we definitely are subject to the regulations of advertising as it relates to both prescription products, which are even more tight regulations, and then medical devices, which has a bit more allowances, but still there's regulation. And that there's good reason for that too, in terms of ensuring fair balance, ensuring that the appropriate claims are made, et cetera, that you're not misrepresenting because they're still medical procedures, right? So we want to make sure that they're being positioned appropriately. So I get that, and I fully understand that. And I think it's appropriate. Where we see then, it starts to blur is when, we start to see, to your point, at the customer, the clinician, surgeon level, and talking about that. Should they be subject to the same regulations and the way it's been discussed? I'll maybe leave that one for you to answer in terms of because it's not my area. I do get though from like if I look even across competitors, etc., that are talking it, I want to make sure that it's appropriate, right? Number one, that they're representing appropriately, that there's data to back it up, etc. There's a fair balance where necessary, etc. So that that's it's substantiated, right? And it's a fair communication versus opinion that could be that could be more subjective, etc. That's what, at least on the industry side, I think it helps make sure that there's appropriate communication channels. Are there other models? Yeah, I think there's other models. Like if you look in Canada, on the prescription side, it's quite strict, right? It can be quite limiting what you can actually say. You can't make a claim, a product claim with a brand name at the same time, right? You have to separate. You can have brand, price, and quantity, and one, and then anything. You can't even say what it's for necessarily, right? Or not necessarily. You can't say what it's for, so you have to separate that. And if you're advertising a prescription drug, you can talk about the brand. Can't say what it's for. You can say what it costs, and you can say what size it is, and that's basically it, which is very limiting. Could we expand that? I mean, that takes a whole drug act change, etc., and advertising changes, which I think is a long haul. Would there be benefit? I think there's opportunity. I mean, look at the U.S. They have a lot more leeway in terms of what they say, but they also have to balance that, and that's when you get those major ads with all the potential side effects, which can scare people away. So is that good either? There's probably a nice medium in between. But is there opportunity to talk more about it? I think there is, but of course we have to stick within the regulations that we're in right now, of course.
Yeah, I absolutely agree. We got to stick to the regulations, but it's just interesting as to kind of how it plays out, because it is different when you're talking about, let's say again, a blood pressure medication, and if you have a physicians who, for instance, I don't think you want physicians out there on social media talking about, I prefer this blood pressure medication, or I mean, it's just far too complicated, and there's a lot of factors that play into it. And in aesthetics, however, there are distinct preferences. Like in the filler market, for instance, certain types of fillers, a practitioner will have strong preferences about a type of filler for a certain situation. And in fact, I'd go so far as to say patients or customers also have strong preferences, and many times you have people coming in who are very, very knowledgeable about these options, and they know what their preferences are, and they're actually choosing a practitioner based on what that practitioner's preferences are. And I think if we look at those two categories as being the same, we're totally underestimating the awareness and the savvy of the typical person who is pursuing these options. I think we're not giving them enough credit to be able to make decisions and understand the options. That's a little bit of a generalization, but I think I'm just trying to illustrate that I have a hard time with regulations that don't differentiate and look to treat everything the same.
Yeah, and it's fair. And also, like you're saying, the modes of communications are changing rapidly, and I don't think our regulations have necessarily kept up with the changing times, the different modalities, et cetera. So I think that's absolutely fair. And, knowing how to change these types of things, it's such a long process. But by the time we change this, I think they'll already be out of date by the time they're modified. But anyway, it's
and the other, I mean, that's a good point. And the other part of it is it's such a global market now. I mean, really, like it's kind of foolish to think that when we're advertising to patients or educating our patients, we're sticking to the small geographical area that we're in. I mean, nothing is limited to that geographical area. I mean, anybody who's on social media knows that you've got people from across the world that are following you, and even patients here, they're not necessarily just following the few people that are in their geographical area. They maybe follow me, but then they follow somebody in Los Angeles and somebody in Brazil and somebody in London, and all those people have different regulations and that they're following, and it's not uniform, and so it's seems a little silly to have geographically specific regulations, doesn't it?
Yeah, no, I absolutely get you. And I mean, we've been dealing with this with television advertising forever, right? The U.S. advertising coming over to Canada, and I hope we don't get to the stage, on the internet where you've got geo blocking. I just don't think that's realistic. I mean, obviously, there's certain countries that do that, but in the free world, hopefully, that we don't see that happening. So I do think we need to, we need some people smarter than me to get around the table to try and sort out how to actually solve for this. How do we actually address this issue from a regulations perspective to factor that, there are these differences and that there aren't the borders in terms of this communication channels. I think it's absolutely a good point.